Well, the problem is that through the shelters that I work at, we're still seeing animals come in with diseases like parvovirus that are obviously coming from communities where the overall vaccination rate is not high. And so we need to focus on increasing herd immunity so that we basically see less of these animals coming in diseased and sick to shelters.
We're very lucky here at Normanhurst. Most of the clients are very aware about vaccines and very accepting to have vaccines done. Sometimes people buy a pet from outside this area, and it might come from a pound that hasn't had all its vaccines, or it might come in with a certain disease. So from the overall herd health, we make sure that puppies and kittens have 3 vaccines, just in case another pet comes into the area with something that's transferable. We want to make sure the whole herd are covered very well and don't get those sort of things like kennel cough or parvovirus potentially.
Yeah, I've not only heard about these recent outbreaks, but I see them, in the clinics that I work at. So parvovirus is still a real threat to Australian dogs, and I see it every week. And so, for me, our energy should be thrown into how do we increase the overall vaccination rate, because parvovirus is a preventable disease with vaccination. So we're doing something wrong if we're still seeing animals come in with parvovirus.
The thought of an outbreak potentially happening could be related with the general herd not having sufficient uptake of vaccinations, and therefore when there's a problem, a lot of the pets aren't covered and they can pick up an infection. It can spread quickly. In this area, there is a very high uptake of vaccinations, but having said that, there's a lot of factors that we don't know about, and so for example, there's a lot of foxes in this area. We're surrounded by bush, and in that bush there's lots of foxes. It's quite possible that those foxes could be carrying things, whether it's heartworm, whether it's distemper, whether it's parvovirus. Could they be carrying something that could then mean that if the herd's not sufficiently covered, they could transfer it onto the client's dogs potentially. So there are a lot of factors out there that we just don't know and we potentially can't control. So it is very worthwhile that we have sufficient coverage.
I think there's definitely a role for triennial vaccines in certain animals, but my general view at the moment is that where compliance is poor, so where maybe owners aren't really good on the uptake of annual health checks, because these vaccines are so safe, anything that encourages annual health checks with the veterinarian, from a welfare point of view, is a really good thing. So for me, yearly vaccinations, if they do that, are a clear welfare benefit.
At Normanhurst Vet Practice, we give an annual C5 vaccine. It's a protocol I've been doing for a long time. I like that protocol because it's very easy for clients to understand. It's not at all confusing. They're very used to that way of doing things, as opposed to a triennial, which I think there's a lot of misunderstanding about the triennial. I think a lot of people don't realise they have to come in once a year, or if they do know they have to come once a year, they don't know where they're up to in the course of 3 years. And the result of that is the clients get very confused, and if the pet's going to boarding, the boarding kennels get very confused. So we're very happy with the yearly C5 vaccine.